everyone. Welcome to the From the Ground Up and Building a Foundation. You are in the right place for the CareStack event. It is exactly 12 o'clock Central, 1 p.m. Eastern. However, we will get started in about 1 to 2 minutes as we let some other people trickle in. I see Dr. Edwards. Hello, Dr. Edwards.
Hey, Tracy.
We'll give it probably like another minute, let some other people join in. And I do want to point out your cameras are intentionally turned off. You guys are on mute as well. If you do have any questions, please put them in the Q&A or please feel free to send a chat. I will be monitoring this. We do want this to be as interactive as possible. The panelists we brought here today are here to help you guys answer any questions you have. Any questions that we are unable to answer today, we will be tracking, as this is going to be a series in which we will be answering those questions throughout various episodes. We'll be bringing in, you'll see Ian, Chad, Tyler again in future releases. You'll see some other things on marketing. So we're excited to have you guys today. And we are actually about 2 minutes over. So let's not punish those who are on time. We can go ahead and get started. And then as people jump in, they'll be brought to speed or they can watch the Facebook Live. But again, you guys are in the right place. Welcome and thank you for joining us for the From the Ground Up, Building a Foundation. I am joined by Tyler, Maria, Chad, and Ian, all subject matter experts from the dental industry, and they're here to talk about really building a foundation for de novos and startup practices. And again, I do want to mention that your cameras are intentionally turned off. You are on mute, so please use the Q&A and chat functionality or raise your hand. If we do need further clarification, we will unmute you guys as well. But with that being said, Ian, I'm going to let you kick it off and introduce yourself.
Great. Hey, thanks, Nicole. Hey, everybody. I'm Ian Brock. I want to start by saying thank you and how excited I am to be part of this panel. I work at Clifton Larson Allen, CLA, and I'm part of the healthcare business operations team focusing on dental practices and physician practices and groups. My primary focus today is within the dental industry. I have 30 years of experience in healthcare services, with 25 of those years in the dental industry, primarily focusing on finance and operations. CLA is the 8th largest accounting firm in the country. We provide more than accounting services, and we'll share our website at the end of the session so you can see all the services that we provide. In my role today, I work with practices and groups of all sizes and stages in their life cycle. I provide strategic insight and guidance, helping practices drive organic and acquisition growth while remaining focused on managing expenses and maximizing opportunities. I look forward to sharing my thoughts and ideas to help you as you embark on this journey.
Thank you, Ian. We're excited to have you. And Maria, I'll let you introduce yourself next.
Hi, everyone. I'm Maria Fuertes, and I'm the director of the Practice Heroes program in CareStack. I worked over 20 plus years in the dental space as an operational leader, focusing on scalability in de novos. And in fact, I began my career managing de novos. In my current role in Practice Heroes, I'm bringing my expertise as an operations strategist to the client, and I'm happy to be part of this important discussion.
Thank you, Maria.
Welcome.
Very excited to have you here today and part of CareStack. Chad?
Hi, Chad Hendricks here, owner of Clear Choice Consulting. I thought I had some good years of experience. I have 18 years of experience, but Maria and Ian beat me by a good chunk there. I've been working, like I said, 18 years, 16 of those years with large dental groups, working focused on payer relations, credentialing, revenue cycle, and a lot of growth with new offices. As you know, DSOs have a lot of offices, growth and acquisitions and de novos. So working through all of those intricacies. And then 2 years ago, started my own consulting company to support really smaller groups, 5 offices, 1 office, 15 offices, doesn't matter. I was supporting a lot of different size offices with the same kind of endeavors, the payer relations and credentialing, de novos, UCR analysis, things like that. So happy to be a part of the panel.
Thank you, Chad. And Tyler, I'll let you introduce yourself and then I'll kick it back off to you guys and you guys can give these de novos some tips and tricks on how to actually build their practice from the ground up and provide some insight that you guys have gained over all of these years.
Awesome. Well, I'm Tyler Phillips. I'm practice manager for D. Brian Williams DDS in Charlotte, North Carolina. And I'm the rookie here with all these rock stars on this call. I've been in the dental world for about 7 years, managing the practice, helping build other practices, and working with de novo. So I'm excited to be here and kind of give you guys some tips for what we think is important when you're starting your practice. So I'll kick it off here and we'll start talking about what was important for me and what I feel like it would be a value to you when you're looking at starting a practice. So the big thing that everyone needs to focus on and remember is you have to devise a plan. You need a long-term plan for your business goals and your model, and you need to develop your tactical plan on how you're going to get there. These are very important to have it laid out and know exactly where you want to be and where you want to go with your practice. You know, what type of dentistry are you going to do? Are there going to be any specialties? What kind of culture do you want to build within your office and with your team? Characteristics you look for in employees, things like that. You know, develop your core values and brand your office. I think, you know, for dentists, you're taught how to do dentistry and you don't really know all the business things. So it's very important to have a plan in place and make sure that you have proper resources to execute that plan. So, you know, we were very fortunate. I came on board with an office and we were quickly growing, rebranded, and started to just explode. So we had laid out our plan. We were very fortunate enough to work with a wonderful CPA financial advisor, and we worked with a PEO, a professional employment organization. So we had a business development team. So we were fortunate enough to have all these people in our corner to lay out a plan and figure out how to execute it. So, you know, we started with a 5-year plan that quickly happened in a year. And so then we were building a new office and expanding and, you know, tripling the size. And then we move into that space. And then our now next 3-year plan is happening in a year and a half. And so now we've expanded even more and we're adding associates. So you have to develop your plan and have it clearly laid out. And, you know, you can move at your pace, but it's very important to have everything staged out and focus on taking it a step at a time. You never want to try to do everything at once and overwhelm yourself. One of the biggest things I've seen with a lot of dentists is they don't necessarily have all the resources they need and they don't delegate properly. So I always think that having the resources is very important. So, you know, we set quarterly goals to hold ourselves and our team accountable and you know, determine what your key performance indicators are that you want to, you know, to track, and your management hierarchy, and have that set and in place. You know, these are very things that are important. So all of this is very important for developing a solid foundation for starting a practice. You know, I've went into practices who they've built beautiful new offices, they've got everything there, but they have no business plan. So it's very, very important to really set your goals and make sure that you're focused on what's important. You know, how are you going to get there? Again, having the resources such as a really great CPA, financial planners, advisors, you know, deciding what software you want to be on so that you can get proper training prior to opening. You know, one thing that we did that really helped with our success, we actually were in the process of building, we were looking at new softwares. We went ahead and picked our software, did all of our training. Then that way, when we transitioned, we weren't moving into a new space, new equipment, new software all at once. So you definitely want to keep in mind that you don't want to overwhelm your team members. You know, you want to definitely phase it out. So, you know, you need to think about things like, are you going to be fee for service or insurance space. There's so many questions with opening a new office. So you just want to focus on what's important in that plan. So
Tyler, I have
yes.
a question. So like, I mean, you guys have done this from the ground up. So when you say like people need to have people in their corner, like where do you recommend they find these individuals? Should they, like you said, get a CPA? Who does the forms? Should they be reaching out to someone to help with forms, credentialing, things like that? Because like you said, this is a big project to take this on by yourself. And also you're saying basically a plan without a goal is like just a wish at that point.
Yeah,
You need people in your corner to help get you there.
it really is. It's a huge project to take on. And so you do need people in your corner. And I'm telling you, whoever says that insurance isn't hard, I want to let them do that for me. So I think Chad may be able to answer those questions for us.
Yeah, no, I mean, maybe this is actually a perfect time for Chad to probably speak on this. Because Chad, I have a big question. I think this is like $1 million question for people. When should they start credentialing? Because credentialing is like, it's one of those mystery words. People aren't really sure what it is and when to even start it. It's a scary word actually to think about, not gonna lie.
Yeah, no, I think you're right. It is important. And as Tyler said, having a plan is important, and you need to have a plan when it comes to credentialing because it can trip you up for months and even years. I hear offices with horror stories like we still have claims problems from when we opened our office 2 years ago. So yeah, credentialing is a scary word. Insurance can be a scary word. And partly because the insurance companies are so difficult to work with. You kind of want to avoid them as much as you can. But when it comes to a new office or a new doctor credentialing, you can't avoid it. You have to get it done. And it's so important to do that. So yeah, to answer your question, when you open a new location, it's important I always have a frame of reference of like 90 days is kind of your drop dead date. You want to have a 90-day window, at least a 90-day. If you have more time, that's great. If you have all your information, if you know your entity name and your tax ID, your phone number, your address, I mean, all those basic things, what doctor's going to work there, that's also a part of the puzzle as well. Because if you're moving a doctor that's already credentialed, there's different timelines than if you're just hiring someone off the street who's never been credentialed with an insurance company. So the 90-day rule kind of gives you some good guidelines there for that, for the credentialing side. But as also alluded to, you need to know what insurances you want to be a part of. So it's good to do some diligence with that and reach out to those carriers. The 90 days will give you an opportunity to also do something that most offices don't realize they can do, and that's negotiate rates. It's one of the things I do with my group, with my company, is help offices negotiate rates. And I think it's very people are just uninformed that you can, with many carriers, not all carriers, you can negotiate rates with them. So when you're opening up a new office, you want to take that time to go and discuss it with the carriers and say, hey, we're opening up a new office. What fee schedule can you offer me? It's important to have that discussion. Well, you may intend to join their plan because you have patients or they're big in that market, but you always want to have that discussion. I see so many times where an office does the credentialing and they never have any discussion about fees, and they just sort of get the fees that they're given. So it's important to ask those questions. And again, it may not take you to the great, 100% of your UCR or anything like that, but it's going to be better than just accepting their default schedule. That's their goal, is that you'll say nothing and then you'll get their default schedule. So it's important to have that dialogue, move it up a notch or two on their schedule hierarchy. But it's, like I said, just important to have a plan. 90-day window, get all your information, know what doctor's going to be providing services there, and then reach out to the carriers that you want to enroll with. Start the enrollment process, the credentialing process, but also start the fee discussion process at that same time. I think that's an important piece that is usually disconnected. Maybe they try to do it after the fact. I've seen this as well. They credential, they start at the office, they open it up and they go, wow, these fees are terrible. And then they want to go to the carrier and say, hey, I want to discuss a new fee schedule. And they're like, well, no, you just signed a contract. You're locked in for a year or 2 years. There's like sometimes a minimum window when they start a new contract. So it's important to do that. Another key piece with credentialing is you've got your plan, right? 90 days out. And I sent in all my insurance paperwork to all the carriers. And it's important that you do diligence with that. You don't just kind of send it off and forget about it and hope on your day you open, you're good to go. You need to be very diligent with the carriers, following up with them regularly, every couple weeks, every 2-3 weeks, whatever it may be, checking the status. Is everything good to go? Are we set up for our open date? Is there any more forms you need? Because that's, again, a notorious thing by the insurances. You'll send in what you think is correct, and then they go, oh, well, wait, you're a new office. Oh, you need a new office form. It's not just the regular credentialing form. Or we need a new contract because you have a new tax ID number. So it's just important to be following up, asking questions, making sure you're getting everything they need. So when you open, your claims don't deny or pay out of network or whatever may happen with the carrier, or pay the patient. I know Delta likes to do that. Some other plans like to do that. That becomes challenging. And the last thing you want is challenges when you're opening up a new practice. So that's a pretty good overview on the credentialing side, I think.
Yeah, no, and Chad, I mean, like, how do people know what insurance plans they should accept, umbrella network plans, like which ones they should actually credential with?
Yeah, good question. I mean, that's another the $1 million question sometimes, is just it's good to, if you have a practice and then you're opening a de novo, right? So you already probably have a baseline of who you accept over here. Even if you're new to a market, you may have some idea of who the carriers are. So you want to engage those carriers, the larger carriers, to make sure you're at least having a discussion that's where the patients are coming from. I think roughly 2/3 to 3/4 of patients nowadays want to see a discount. They want to go in network. So it's important to find those in network providers. So for the patient, so you want to make sure you're in network. They're going to choose another guy down the road if you're not in network. So it's important to just know which plans are in the market. Have those dialogues with the plans to understand the fees you're going to get. If they're acceptable, you don't want to take like Medicaid rates. So it's important to know that. But also just to understand some of the nuances of these plans. Like if I join plan A, am I also in default in plan B, C, and D because of all these partnerships they have? There's also umbrella plans, as you mentioned, Nicole, leasing plans. Trying to think if there's different terms, umbrella plans or network plans. And those plans have many sub plans under them. So I take a plan and now I'm in 30 other plans that are subgroups or carriers. So it's important to know who all you're getting, contracted with, and are you in those plans? I see it a lot where they don't realize, an office doesn't realize, I'm in plan B because I'm in plan A, and they turn patients away. So you need to know about those plans and understand what all comes along with that. And you just have to, again, have a dialogue, ask the carriers. They should be giving you clear answers about the fees, about who their contracts are tied to. And so having those discussions, and you don't want to, there may be a plan out there that pays really well, but they're not in the market. They don't have very many members. So again, don't bother credentialing with them. You're just doing extra paperwork. You really just want to get with the plans that are going to drive some patients to your door.
No, yeah, absolutely. And I do have one more question for you, not to put you on the hot spot, but like,
no,
how often should a practice update their UCR fees? Because I mean, I know I hear it all the time. I'm sure Maria does. I'm sure you do too. That's a big question. Like, do I do it every year? Do I do it every 5 years? What's the answer? What's the best answer?
Right. No, that is, that, and the payer discussions, the insurance side, the credentialing side, and then the UCR side is another big three that I talk about when I think about what I support offices with, but in general, just what an office should be looking at in the overarching kind of life of a claim, if you will. So the UCR fee, what you're charging. I think it's important to review it annually, whether you do a full-blown analysis using market data, from Fair Health or NDAS, a couple of resources out there you can use that you can purchase, market data, and you can do a comparison. I hear it so often that they go, a new client of mine will say, yeah, we're at the 80th percentile, and I'll do the analysis with the real market data, and they're at the 50th percentile. Or they'll even have fees below payer fees, right? I was working with an office that they charged, $700 for a crown, and the payer was paying them $800. Well, they were only getting $700 because their UCR was under the payer rate. So things they don't realize. So it's important to level set yourself with the market. It's important to compare to what your payers are paying. The insurances want to see discounts. So that's where, to your question, really raising your rates, at least with market levels, which typically go up 2 to 3% a year, annually, is a smart move. You're showing that you're keeping up with cost, you're keeping up with the market, especially with 2020, the cost went up by a lot, we know, with COVID. You want to make sure you're increasing your rates. Even though you may have all insurance patients, you need to be showing the insurance companies that the dental office is raising their rates to keep up with costs. The insurance now needs to follow suit. I see that a lot where their offices haven't raised rates in many, many years, but they expect the carrier to raise their rates. And the carrier can just come back and say, well, you haven't raised your rates. Why would we raise our rates? You just want to eliminate that aspect of the dialogue and show them that, hey, I'm charging $1,200 for a crown. You're paying me $700. We've got a big differential here. And they can still show a good, healthy discount to their members was what their goal is, to show that, hey, you're getting a nice $500 discount by taking our insurance or buying our insurance. But they can still do the same by giving a lesser discount. So it's important, again, to circle back to your question. I mean, I recommend looking at it annually and raising rates annually, even if it's a small amount. Because usually, again, another common thing I find is that maybe their overall average is the 70th or 80th percentile, but they've got some straggling codes that are way below market. You want to always be kind of right sizing those codes and adjusting them up to make sure you're charging the right, full fee, which affects your cash patients, uninsured patients, but also, as I alluded to, your insured patients through negotiation.
No, yeah, absolutely. I mean, thank you for answering those questions, because I think those are questions that everyone has, whether they want to know it or not at that point.
Yeah, I agree. I think these are all areas. And again, I think there's a lot of fear around these areas. Credentialing, what is it? How often should I raise my rates? How do I even raise my rates? Well, again, that's something you decide as a doctor, and you make those decisions. You update your system, and those are your new rates. You can notify your carriers as well. That's important, but that's important. But it's good to know, again, circling back to one of your other points, what plans you're accepting, right? So the plans you accept ties into so much more, that beginning part of the rev cycle, the beginning part of the life of a claim, because that leads into a lot of other things. And I think Maria can maybe touch on, what I know what plans I accept. Now, how does that sort of affect what I do in my day-to-day work?
Right, Chad, you bring up a very good point. It's important to know the fee schedules with the insurance plans you're in network with. And most importantly, in my book, it's important to enter those fee schedules in your software. These accomplishes several things. Number one, it creates transparency with the patients, clarity. They know what they're going to be paying up front, as well as what their insurance is estimating to pay. When they receive their statement, they don't have to do these machinations of deciphering where the balance is coming from. Number two, when scheduling their next appointment, once again, there's clarity as to what they're going to be paying up front. So let's take, for example, if the patient has already reach their annual maximum, there's no question as to why they have to pay more out of pocket. Number three, with respect to adjustments, you're now writing off and know what's truly collectible up front, basically, at the front end, instead of waiting 30, 60, 90 days for the payment from the insurance for you to make that adjustment at the back end. And number four, your staff doesn't have to create a copay calculator to estimate what the patient owes. I've heard of patients not trusting their copays when they're presented to them this way manually. In fact, most of them don't want to pay their portion. They're waiting to pay for the insurance to pay theirs. So this results in accounts receivable issues, cash flow, and trust issues with the patients. And we know trust is the key to building a foundation, and you need the cash flow to run your day-to-day operations. I'm going to kind of segue into checking patients' insurance eligibility, because the topics that I'm talking today as well, it's all about creating process and structure. So checking patients' insurance eligibility, it's best to be proactive by checking their eligibility as well as getting their breakdown 2 to 3 days ahead. This process helps with quick and accurate treatment planning, especially if the fee schedules are entered in the system. I've seen instances when eligibility was not checked. The practice had to write off the insurance portion, obviously resulting in issues with cash flow, and it is also affecting the patient's patient's experience. This is all part of what I've seen where, new team members struggle. So it's all about creating processes and structure. Kind of want to now pivot to communication. This is where I find that as practice leaders, as a doctor, we hire people on board. We all think that they know what they're doing as a dental assistant, or whether, the front desk person because of all the experience, but in fact, as the leader of the pack, you have to build a structure, right? And communication is key to building a foundation. Effective, quality-based communication is a developed skill amongst the entire team. And there will never be a day where effective communication is not a necessity. So I want to talk about the daily huddle. This is an undervalued form of communication, and it's the most effective with your team, not to be confused as the monthly team meeting, okay? So huddles are a lot of things, but they're, to me, in my mind, top of mind, they're like 5 things. Number 1, it's informational. You share the knowledge, you keep the team informed, it lessens confusion, miscommunication, and frustrations throughout the day. Number 2, it's problem solving. This is where team members feel safe sharing challenges that need resolution. 3, it's all about team building. It creates a sense of teamwork with everyone. It's also, number 4, motivational. You begin the day on a positive note. And 5, it's a lot of things. These are the things that are important to me. It creates alignment. It promotes accountability. It helps in creating structure. Tyler touched on building culture. And most importantly, it supports the vision of your practice. These huddles should be energetic, 15, 20 minutes. You shouldn't be sitting down, and just kind of reading things off, kind of makes it boring. Let's start out the day at a designated time, same day, same time. A stand-up huddle is preferable. All teams should be present. The doctor as the leader, you're the captain of your ship. You should be leading it unless you've had the luxury of hiring a practice manager in the front end. And, people always ask, like, what should be the agenda? Well, things that are most important to you. But, I have a couple of examples. An agenda should be like your playbook, right? So playbook for the day, playbook for your office, things that you go to all the time. Some of the examples are reviewing key items for the day, such as patients coming in, unscheduled treatment, those are same day treatment appointments opportunity, insurance coverages, which is what we talked about with Chad, large balances expected, or those with past due balances that need to be collected before the patient leaves. So we talked about entering fee schedules in your software, creating transparency and clarity with the patient, by, making sure that they know what their patient portion, their copay, what the insurance is estimating to pay in the front end. Holding daily huddles as an important form of communication to discussing key items. These are some of the activities towards forming structure, setting goals, and creating processes for your practice. Ian, what are your thoughts?
Sorry, Maria, I unmute myself. Yeah, no, I want to say something. I'm gonna go back on something that I heard at the beginning. I love that what Tyler started with, and I loved all the conversation around plans, right? Plans. These are the things that that are near and dear to my heart. And putting all these structure and this process in place, it's important in so many ways. And my role, when I spend a lot of time in finance and operation, this is near and dear to the stuff that we're doing in finance and operations. And the systems, and I'd say the systems and processes are critical to the success of the practice, right? And it's more than the systems in place to just hit and get you to revenue. Maria, as you're talking about fee schedules, which is important, and expenses, but talk about all the systems that that Tyler talked about, right? When you get through the practice management system, you get through everything that happens, day in and day out through the practice. It's just so important. They're all equally important, to the success and viability of the practice. And again, I'm going to pick on the word that Tyler has said because I liked it. It's like you have to pick the items that are important, right? But but you need to understand, and I think where I want to talk a little bit about is about those systems and processes in place and why they're so important, right? And I may take a little bit different approach in thinking that you need to put all of them in there, right? And get to all those, but they are important to the success of the practice. And if you're thinking about if you think about marketing and advertising, right? How are you measuring how you're spending your marketing and advertising dollars, right? And in a de novo, one would easily say, well, it's just about, are you getting new patients into the practice, right? But as you go on and as the de novo matures, and where, Tyler saw it with his practice, right? You start looking at this and you start thinking about, not just are my new patients still coming in, but am I still getting patients coming back into the practice? What's the quote unquote the stickiness of my patients, right? Are they coming back all the time, right? And that's equally important. And those are important to understand. Are you investing your dollars in the right spot? And as we all know, right, and the advertisers of the world have taught us this, is things change over time, right? What advertised at one time, maybe pre-pandemic is going to change post-pandemic, and we have to be agile, right? And one of the things, really important, excuse me, is being agile, right? Being flexible, to what's happening in the business, and how do you respond to it? A lot of people always ask me, well, I get it, makes sense, Ian. And then they say, but why does finance care so much, right? But, the role of finance, we're often we're often the first, what I would say, professionals brought into the business, right? We're brought in, and putting a structure and process in place to deliver the financial close, which is important. I would always like to say a timely and accurate financial close is important, but, the finance folks are in there to help you understand, what's happening in your business, right? If if I'm sitting across the table from a doctor, and we're talking about the business, you want to be having that face-to-face conversation, and you want it to be more than just just about the what's on the income statement, even on a balance sheet, right? You want to talk about, excuse me, you want to talk about, what I like to say, how do you operationalize your information, right? And some of the stuff we're doing at CLA today is we've done that. We've operationalized the financial reporting, the scorecards. We put in in quote unquote one piece of paper. We have on there the key metrics we're looking at, the patient visits, new patients, revenue per patient, so forth, and understanding that. But we also have in there information, including the financials. It allows us to put everything in one spot and start building action plans to to areas that we want to focus. And again, I'm not a clinician, but I always, I think about how doctors talk about their treatment plans, right? And you can have this one giant treatment plan, right? And try and do everything at once, or you chunk it down. And what we're doing in finance is a lot of the same thing. We're taking things and we're chunking it down. Do things in 90-day increments, right? Focus on, A, then B, then C over 90 days at a time, and you can start making some improvements. But without those systems in place, without understanding how you're going to do things, right? How you're going to do things from as simple as I want to order supplies, right? How do I order supplies? Who do I order supplies from? What am I ordering? Who's going to approve it? All these things, they seem simple, right? But they need to. And again, what I heard what Tyler said was you need to have some experts in there, but you also need to have some other people in the practice that you can turn to do these things, right? The role for the doctor, if they're still working chair side, isn't to work all day chair side and then all night trying to do all these things in the practice, right? You want to start and this is often where things fall down in my mind, is they try and do everything, and you should know what's going on, which is why it's important to get the information on a monthly basis and sit down with your accountant. Or today we're all doing things via Zoom or Teams or whatever, but having those conversations, looking at stuff together, right? But having people on your team, like Maria said, of developing people on the team that can do these things, who you can trust, right? Because it's so important to the long-term success of the practice. Again, excuse me, I don't know what's going on. But let me just take one more step, and I want to take a step back, and I want to talk about business plans, right? Because business plans are important and they're critical, right? And business plan, when Chad was talking about going and talking to the payers about negotiating fees, for me, that happens after your business plan is in place, right? You kind of already know where, perhaps you know where you want to go. You might go to the payers, insurance plans, and say, hey, I'm looking to do a de novo and I'm thinking about these areas, are there opportunities? Do you guys have demand in these areas? Do you have places where you don't have enough coverage, in patient care, right? There's opportunities of it. You need to put a business plan together. Business plans are important in so many ways. The biggest being, hold on 1 second. Yep.
No, you're okay. And actually, I wanted to chime in, and maybe you're leading into this, but how do people get started? And how long does this process take from when you have this idea to do this to actually see it come to life?
Yeah. I mean, that's a great question. I'd love to tell you that you could, and Tyler will probably validate this. You don't just put a de novo up overnight, right? It takes time and thought to put all this stuff together. So, in my world of experiences, most de novos are taken somewhere from the idea for where you're starting, Nicole, to the finish of opening the doors could be 9 to 12 months, right? It could happen faster, but there's so much that needs to go into all that stuff, right? And it sounds like a lot, but you got to put a business plan together, right? Again, talk to advisors, talk to CPAs, whoever, and start putting a plan together, because you need to get in front of the banks, right? And you need to get some loans, right? You're going to have a construction loan usually to build it out, and you're going to have a loan for all the equipment, and if you might have a third loan if you're going to buy the building, which you see a lot of people doing. But you need to put all these things together and start coalescing it all together. And what I like to say to people is the business plan is the easiest part of the process. While it sounds overwhelming, right, it's the easiest part of the process, because when you're done with it, quote unquote, you have everything on a piece of paper. Oh, it's a beautiful business plan. It's a 5-year plan. It's going to be glorious and so forth and so on. But once you start going, right, the rubber meets the road. Your assumptions that you have in your business plan, the things are going to happen differently, right? And this comes back to that word being flexible and nimble, right? You need to be able to move around and be flexible to do some different things and try some different things, and reassess how your business plan is working, right? Because it's never going to be perfect. Your assumptions in a cold sterile world will be perfect, but when you're talking about these real business plans, when you open up the door, the day one, you said you're going to have 10 patients and only 5 showed up. Well, boom, now you've just blown your business plan in a bad way. Or you had 10 on your budget and all of a sudden 20 showed up. Hey, now things are great. Now, whoa, maybe I should be open more than a couple days a week or whatever that number is. And one of the things that I see is, just getting people to understand, what the word de novo or startup, when you're thinking about these practices, right? Again, what I'll share is my knowledge of what I'd say the average things are. Tyler gave the example of what happened with their de novo. That's the anomaly, right? That happens. Don't get me wrong. And I don't want to dissuade anybody from wanting to do de novo, but there is an opportunity to do a de novo, right? To do a de novo, and the standards usually are that, in the first year, your EBITDA, as everybody knows, usually that word's a popular word in dentistry today, your EBITDA and your cash flow are negative in the first year, right? In the second year, your EBITDA might be positive, but your cash flow is negative, right? And then when you get to the third year, your EBITDA is break even, right? So it's very challenging. My answer machine is going off in the middle of this. Yeah, it's perfect. Yeah.
It's okay.
Yeah, so and one of the things just on business plans that goes with this, and then we can maybe, Nicole, I'll turn it back to you, is it's also important for you to do a personal plan, right? Put a plan together, because if you're going to be in this practice full time, or you're going to be a absentee owner, right? You need to think about what that's going to look and how that's going to impact your own personal compensation for the next 2 to 3 years, right? Because that's the real thing. If you're in the practice, you're likely, if you're working in the practice as the doctor of the practice, you're likely not going to be making the same money you were making when you were an associate somewhere else, right? Unless you're knocking the cover off the ball. So there's a lot there, right? And getting yourself knowledge, right, as part of the process, right? So we're getting out to the world where things are a little bit better. Meetings and conferences are starting to happen again, where we can go out and meet with people face to face. Attend the meetings, right? Get onto webinars like this. Get out there and listen to podcasts, whether they're dental specific or there's non-dental specific things that Maria talked about when you get into culture and leadership and those things. And start talking to people about who are the advisors should I be working with, right? Talk to who should be on the legal side, the accounting side, the tax side, so forth and so on. There are experts are out there, and I'll tell you, people like myself and Tyler, Maria, Chad, and others, we want to help people, right? We want to help people, and it doesn't always mean it's something happening with our company, but we're still willing to help people, be successful, because we know that it's for the good of the patient, right? That's what it's all about.
Yeah, no, thank you, Ian. And actually, Tyler, if you don't mind, I don't mean to like drop it on you, but I'd actually like you to say kind of what Maria, Chad, and Ian just said. I mean, we just heard Ian say, like, you have to be ready to pivot. A plan, I mean, I don't know what you guys plan, but none of my plans in life have gone exactly what I've planned them out to be. Yeah. That would be a miracle if it did. So, I mean, things had to have come up. You guys had to have pivoted. Do you guys do a morning huddle? Credentialing?
Yes.
Give us some background information on that.
I can speak to what all three of these panelists just spoke to. I mean, like with what Chad was saying, I've been in those shoes where we joined the insurance company and all of a sudden we find out that we're a part of 5 other plans because they're contracted. Where that was like early on, I had no clue about how all the insurance game worked. So I learned that the hard way. So it's very important to understand the plan and to negotiate those fees. You have to be an advocate for yourself, for your office. You can't just sit back and say, oh, well, that's, for example, we have a company that we work with, and one of the biggest employers in Charlotte is a member of that insurance company, so I really went and fought for us to get a higher fee schedule and was able to do that. So that's very important to do, is be an advocate for yourself. As far as what Maria is talking about, we do that morning huddle every single morning. We have a big screen TV in our staff lounge, and we go over our morning huddle page. We go through everything together, make sure the whole team is on board. We make sure that those insurance verifications are completed, that the fee schedules are attached, because what Maria was saying about transparency is true. Patients are typically okay with paying their portion as long as they know what that is up front. They don't want the surprises, so we make sure to let them know this is an estimate, but here is what you're, based on your insurance verification, this is what's expected of you and what's expected of your insurance company. So those things are very important and will help you to avoid confrontation with patients or because you also want to think about in the long run your marketing plan, and you don't want bad reviews out there because you've given a bad treatment plan estimate. So that's something to think about. And as far as what Ian's talking about, with the plans and everything, it is just so important. And your plan, you do have to pivot. You're probably going to lay out plans, and 3 out of 5 times something's going to change, and you do have to be willing to move and flex with that. But if you're planning out your timeline, pad it a little bit. We had to pad our timeline. We didn't know originally how much to pad it, so but we ended up going a month over what our plan was for some stuff, and then for our goals we were a lot shorter. So you just have to be willing to move and flex with that. I actually have an office that I'm doing some consulting work with, and they were supposed to go live one day, on open up and go live, and then they said, hey, it's going to be 2 weeks later. You just have to keep it in mind that there's going to be changes, and you have to be willing to just go with the flow and make sure that you're prepared.
Yeah, no, I mean, you guys said it all perfectly. We can't thank you guys enough. But to everyone that's attending today, I did put all of our panelists' contact information on here. they are the experts. If you do have questions pertaining to anything they said or additional questions on things they didn't say, please do not hesitate to reach out to them. They are here to be resources to you to help you get your practice up and running. They're here for you. I promise on that. But I also want to show, oh, go ahead, Maria.
Oh, hey, Nicole. So one of the things that we've also lightly touched base, and I think it's very important to anyone that's starting a business, is establishing vision. Tyler touched base on that, Ian, as well as Chad. And vision is your GPS. Many practices lack it. If there's no goal, there's no destination. So, I think it's important as a doctor about to start his or her practice, it's really important to find out, where do I want to be? What is my, I know monetarily, I know what my 5-year plan looks like, but what is the community and the patients I want to serve? And what type of patients do I want to see? Is it going to be multi-specialty? Am I just going to be doing my own, hygiene for the first time, and I'm going to build it up to be a boutique type of dentistry? So I think it's important to have that in mind. And also, as the doctor leader, it's also good to share that vision with your team so that they will support and contribute to that.
And Maria, I think it goes back to what you said earlier. It definitely creates alignment throughout your organization as well. Everyone's on the same page. You have clear goals and you're all working towards the same goal at the end of the day then. So you said it perfectly. But as I said earlier, I want this to be up here. Take a screenshot. We also will be sending out all of our panelists' contact information, emails, websites, phone numbers, if you would like to get a hold of them. And we also will be sending out a survey to have you guys input questions that you have on doing a startup. I mean, we want to have this whole series be around just building practices from the ground up, answer your questions, bring in subject matter experts, have Chad and Ian and Tyler and Maria back again for a full 30-40-minute sessions. So definitely take a screenshot of that. And here's some key takeaways. I mean, we were taking notes as the panelists were talking. These are some key things that they said. We understand that there was a lot said, but if you're going to take anything away, please take this away. Start credentialing 90 days prior or sooner if you can. Negotiate with plans at the same time you engage with them for initial credentialing. Create alignment by starting every day with a team huddle. If you're a network, fee schedules play a major role in your practice. And don't do this alone. Attend conferences, webinars, join groups, seek out your peers, seek out experts, ask for help. You're not alone in this. And then of course, expect to pivot and put a plan in place. But your plan will not always go as you would love it to. Nothing's ever perfect like that. So yes, be prepared to pivot early and often. Stay on your toes with it. And I think I have this in there twice. Ask for help. It's so important. You are not here alone by any means. And of course, review and update your UCRs annually. Collect. That's so important at the end of the day, both from the patient side and the insurance side. There was actually a fun study done that said 72% of millennials and Gen Zs would actually be willing to switch their provider to have cost transparency, like online appointment booking and things like that, which I thought was actually a really cool, interesting fact to know. I didn't realize that many people, but 72-73%, I believe the study was. But I want to say a big thank you to all of our panelists today for joining us. We appreciate it more than you will ever know. Thank you for sharing your wisdom with everyone here today. And again, if any of the attendees have any questions, please feel free to reach out to the panelists. We will send out that survey again to submit more questions. And we are excited to say that our next event will be focused on marketing, because we've determined marketing is everything. Many people have said, we heard it today, actually. So we are very excited to announce that, and we will be announcing our panelists in the upcoming weeks for that event. And we'll get back to you guys with dates and times as well. So thank you again, Maria, Chad, Ian, Tyler. I appreciate you guys all being here today. And I hope everyone has a great weekend.
Right. Have a
Thank
great
you.
weekend, everybody. Thank you.
Thanks, Nicole. Thanks, everybody.
Bye-bye.
Bye.
Bye-bye.